According to the World Health Organization, 35.6 million people worldwide have dementia. Alzheimer's disease is the most common cause of dementia and may contribute up to 60 to 70% of cases. Dementia has physical, social, and economical impact on caregivers, family, and society. There are currently 7.7 million new cases of dementia diagnosed every year. As a result, it is imperative to know what dementia is, be able to identify common behaviors associated with the disease, and recognize how to enhance quality of life through effective communication and environmental changes.
The WHO defines dementia as a syndrome, usually of a chronic or progressive nature, in which there is a deterioration in cognitive function beyond what might be expected from normal aging. It affects memory, thinking, orientation, comprehension, calculation, learning capacity, language, and judgment. Consciousness is not affected. The impairment in cognitive function is commonly accompanied and occasionally preceded by deterioration in emotional control, social behavior, or motivation. Common behaviors noted with persons who have a diagnosis of dementia may include memory loss, difficulty communicating wants and needs, difficulty with complex tasks such as cooking, difficulty with planning and organizing, difficulty with coordination and motor function, disorientation to time, place, or self, personality changes and changes in appearance, inability to reason, inappropriate behaviors or behavioral outbursts, paranoia, agitation, and hallucination.
In a general sense, there are three predominant stages of dementia: early, middle, and late stages. The early stage of dementia is characterized by forgetfulness, an inability to keep track of time, and becoming lost in familiar places. People at this stage of dementia can still function independently, and the dementia is often overlooked. They are able to still work, keep children, perform home management tasks, and drive.
The middle stage of dementia is characterized by an inability to recall recent events or people's names, increased difficulty communicating with others, increased assistance required for personal care and grooming tasks, and changes in behaviors such as wandering. People at this stage of dementia will require cueing to complete ADL tasks, constant supervision for safety, and function best in an environment with limited distractions. They are still able to feed themselves, assist in ADL activities, perform functional mobility, participate in meaningful social opportunities, and communicate personal wants and needs.
The late stage of dementia is characterized by near to total dependence for ADLs and self-care, severe memory loss, and an overall decline in physical functioning. Other symptoms include difficulty recognizing relatives and friends, difficulty walking, limited motor movements, swallowing deficits, increased behavioral outbursts, and an inability to communicate wants and needs. They are still able to communicate in simple words and phrases, experience emotions, answer simple questions, self-feed with assistance, and respond to visual, verbal, and tactile sensory input.
Caregivers should use the following strategies to enhance quality of life and communication with persons with dementia. Focus on remaining abilities. Do not facilitate overdependence. Let them do what they are able. If a person is able to dress, allow him or her to continue that level of independence for as long as he or she is able. Incorporate activities that will hold his or her interest. For example, a woman who was a housewife and stayed at home with her children may enjoy participating in cleaning or cooking activities. Speak clearly and slowly, using short sentences. Give ample response time. Minimize distractions during communication, such as noise, lighting, movements, and strong smells. Incorporate familiar items and objects into self-care tasks and activities. If a person with deficits once enjoyed a specific brand of toothpaste, ensure that it is incorporated into his or her grooming routine. When given directions, only give one step at a time. Allow the person to complete the step before moving on to the next direction. Minimize obstacles in the environment. Remove rugs from the floor, any clutter, and low-standing furniture. Ensure that the resident has a daily routine which will maximize independence. As therapists, our role in treating patients with dementia is to facilitate remaining cognitive and physical abilities, teach and train caregivers, and implement strategies in their everyday routine to promote independence and improve quality of life. It's important to remember that dementia should never define a person. Dementia affects each person differently. By incorporating the strategies we discussed, you as a care provider can help maintain a person's current level of function for a longer period of time, improve quality of life, and enhance effective communication.
For more information regarding levels of dementia and how to better care for persons with dementia, please visit 360 CEU to take our course, Facilitating Functional and Quality of Life Potential, a Therapeutic Approach for Dementia. You can also visit our website, www.rehabsynergies.com. Thanks for watching.